Good morning, everyone. Today we are presenting our Coil collaboration. In our collaboration, we created a multinational organization centered around electronic medical records. In the following slides, we will talk about why we chose this business and explain some of our processes. The people who worked on this project are myself, Joseph Herbert, Marilee Munoz, Ryan Florio, and Ivan Antonio Martinez Robledo.
Now getting into the reason as to why we chose EMRs. After we discussed our ideas for our project, we finally settled on creating a business focused around electronic medical records. We chose this topic because of the current EMR status in both Mexico and the United States. The electronic medical records are not fully integrated and can cause problems that could affect the healthcare systems in both countries.
Now I'm going to dive deeper into some of the issues that EMRs faced in both countries. Number 1 is loss of patient information. Number 2 is unnecessary healthcare spending. Number 3 is decline in healthcare quality. As the healthcare world shifts away from physical record keeping to electronic record keeping, it is important that we find an integrated and efficient system.
What exactly is worth knowing? Think about how many times you've used the healthcare system. How many times you've visited your family doctor, or a hospital ER, or had an x-ray, or filled a prescription. Have you ever wondered how all that information is maintained and shared between these points of care? Or if it's even shared at all? Now think about how this could affect the healthcare you receive. Look at it this way. You visit a local walk-in clinic where the physician requests a number of tests. Unfortunately, those test results may not always be shared with your family doctor. A month later, you experience similar complications, and your family doctor performs the exact same tests. Wouldn't it have been easier and more efficient if your doctor could have accessed those original results first? In your community, when you visit any point of care, information is collected regarding your health. However, because these systems don't connect, information cannot be easily shared between healthcare providers. So when a doctor is treating you, there may be pieces of your health information out there that they don't know about. Now consider how important communication is in an urgent situation. Say, for example, you find yourself in an ER, and you're unable to properly relay your medical history. Not knowing for certain if you're on any medications or if you have any allergies could hinder the doctor's assessment and even cause problems during treatment. Retrieving your health info instantly could have saved time and reduced the possibility of complications. In order to improve healthcare in Canada, we're working to create and connect a network of electronic health record systems in your community, province, and across the country.
EMRs, or electronic medical records, have grown to be a crucial component of healthcare delivery in many nations, including Mexico and the US. The current state of EMRs in these two nations can, however, differ greatly. The United States has been at the forefront of EMR adoption and implementation. In the US, more than 90% of healthcare providers have adopted some form of electronic medical record keeping systems. The problem with these systems is that they are very different from one another because it differs very from country to country. This can also cause problems when trying to transfer data across systems as well.
Well, in Mexico, Mexican healthcare providers have transferred over to EMRs at a slower rate than the healthcare systems in the United States. This is due to the high cost of EMRs and the hesitation to take the leap into the switching. And now,
When creating our business model, it was very important to account for each country's unique situation. Our goal was to create an electronic medical record keeping system that satisfies the needs of the healthcare systems of both the United States and Mexico. This can be quite a challenge as the healthcare systems are very different in both places. But after doing some research, we did our best to find a middle ground that works best for both countries.
In order to meet our goal that satisfies both countries, we must first create an EMR that we will use in order to convince the American companies to leave behind their current system and adopt this new system. We as well have to get the companies in Mexico to switch from their traditional methods to the new system. Two words that should describe our initiative is integration and affordability.
In order to convince American and Mexican healthcare systems to switch to our EMR, we decided on an efficient interface that is easy to use and implement. This interface would allow for patients to schedule appointments and receive access to their healthcare history. It would also be very easy for healthcare professionals to access information from other healthcare professionals about their respective patients. This would be attractive towards people because they're able to receive their past medical records, and it also lets them know what they can use for the future.
Now, a very important aspect to our business will be to make our AMR very accessible. This will be achieved by putting our AMR on a free downloadable application. We will also offer physical systems that are tailored to our systems.
Next, we're going to talk about the economics of our multinational organization. Because software development is cheaper, on average, in Mexico than in the United States, we will develop our system in Mexico. We also have to take into consideration a lot of the tariffs and agreements that are between the two countries. For example, the USMCA, or the United States-Mexico-Canada Agreement, is something that our company will take advantage of. This trade agreement creates a free market amongst North American countries and was formerly known as NAFTA.
This new EMR system we are implementing will face a few obstacles. For beginners, it faces cultural differences. The attitude towards the healthcare system differ in Mexico and in the US. In the US, there is an all-or-nothing attitude towards the healthcare. Many Americans will overuse the healthcare system, which will drive up the cost for those who struggle to afford healthcare. In Mexico, it is believed that our life is in God's hands, and many people are not as eager to use their healthcare systems available. On the other hand, many others must take on this option because of the lack of services available to them.
Despite the differences in attitudes toward healthcare, there is a common bottom line amongst both countries. Access to healthcare is not universal in either country. This lack of access to care is very concerning and is a problem that has mired both countries for a long time. It is our company's hope that our EMR system can help reduce the cost of care and increase access in both countries, leading to an overall better life in both countries for the people that live there.